I think one of the particular challenges in pediatric neuro-ophthalmology is that we as clinicians really favor a lot of detail. And so we rely on a lot of elements of the examination in the adult patient that children just aren't able to or aren't necessarily cooperative with participating in. So we really have to rely a great deal not only from the history, speaking with parents and other caregivers about what visual limitations or other symptoms the child might have, but also from really observing the child very directly in the clinic space to see what they're able to do visually and other areas where they might have more difficulty. Well, the most commonly seen optic neuropathies in childhood tend to be inflammatory, and so we see optic neuritis in all age groups. The challenge is to differentiate whether that is just a single event from which the child will recover, or if it's indicative of a larger underlying pathology such as multiple sclerosis or NMO. Well, in distinction from optic neuritis in adults, optic neuritis in children tends to be more severe, and it tends to be bilateral, although some recent data suggests that maybe there are more unilateral cases than previously estimated. As I mentioned, the vision loss tends to be more severe, and we often will see optic disc edema or swelling of the optic nerve, which we see less commonly in the adult population. Similar to adults, the most important test in a child with optic neuritis is an MRI of the brain, and we do that to assess for any white matter lesions that might be indicative of underlying demyelination. More and more, though, it seems to be important to think about other variants of optic neuritis, like NMO-associated optic neuritis or anti-MOG-associated optic neuritis. And one of the particular challenges is that some of the features that differentiate those presentations in adults don't do so as well in children, because again, children tend to have a more severe presentation with optic disc edema. And so it might be important to think about obtaining those tests early in the course for children presenting with their first clinical event. Well, in the pediatric population, the most important systemic disease to know about in terms of ophthalmic manifestations is opsoclonus that we might see in children with neuroblastoma. So being able to recognize that very characteristic eye movement abnormality and do the appropriate imaging tests to exclude an underlying tumor is very important. This year, I think the highlights have just really been exceptional science. I think there are a lot of very exciting breakthroughs that are happening, not only in terms of learning the underlying metabolic aspects of disease, but also new treatment paradigms that I think are really going to revolutionize the way that we care for our patients.